Good evening, Mr. Ivo.
Good evening, doctor.
Can you please tell me about yourself and your professional background?
I live in California. I teach yoga. I'm a yoga teacher. In the last 2 years, studied Ayurveda under Dr. Kannada in Remedies. And I work as an independent contractor for studios. I do yoga therapy and yoga. I am a yoga teacher, Ayurvedic practitioner living in California. Practice Ayurveda last 3 years. I study yoga and yoga therapy from Vyšničansko's lineage. I teach it in San Francisco, and to Ayurveda I got introduced 3 years ago, and I studied last 3 with Dr. and my journey continues to Sharda Hospital.
How did you come to know about Sharda Hospital?
Through a friend that sent me email about this hospital, and it has a good reputation, and previous students had a great experience, so I thought I'll give it a try.
So, what was your expectations coming to Sharda Hospital?
Honestly, I didn't have real expectations. I came here because I had a time that I could spend, and so I always kind of keeping the mind clean, so if you don't have expectations, you don't get disappointed.
Yeah, that's a nice line. How was your typical day here? Can you please explain? From morning to evening, what you were doing here?
Woke up in the morning, a little yoga practice, breakfast, and then I meet Dr. Amrita in her office and start seeing clients. Then in between the day we went to have a lunch for 30 minutes. And come back to the office and see clients again, or preparations, making preparations, or having different panchakarma techniques done. And we finish probably around 5 o'clock.
So, preparations of medicines that are used in Panchakarma, you mean to say?
Yes, medicine that was prepared, used for panchakarma.
On an average, how many patients were you able to see in a day here?
Oh wow, it was a big amount actually. I was pleasantly surprised because I used to see 1, 2, 3 patients a day. This was the first day I see probably 30 patients. Second day also around 30 patients. So probably like 30 patients a day, sometimes less, sometimes more. Yeah, and I was also seeing different doctors and seeing different rooms, the panchakarma rooms and the preparation. But it was around 30 actually, yes.
When the patients were there, was the doctor cooperating with you and explaining in terms of Ayurveda how the diagnosis and treatments are planned?
The doctor was busy with the patient, so she has to, of course, take care of the patient first, so I understand. So we usually discuss the case after the patient's visit, and if we had a time, sometimes the patients were coming one after the other, so we couldn't really have a discuss. But the doctor was tremendously helpful. She was giving me questions. I gave her questions back, answers. So it was a very, very pleasant experience.
So you were also taken to the rounds to see the inpatients who are admitted here?
Yes. Every morning we went to see patients.
Can you talk about some interesting cases, one or two maybe, that you saw here that you remember?
Wow, there were so many. It's actually there's one case I see this child came here, was mentally challenged. It was saliva dripping from the face, complete. You couldn't focus. There was no eye contact whatsoever. Couldn't walk. And I saw him after days, and the child was walking. Complete eye contact, smiling. I was like, this is miracle. So that was one of few cases actually. But this one was like very heart-taking.
How were the staff and consulting doctors here with you?
Oh my God, the best. They're just simply the best people. So kind, helpful in every way. Like very, very, very humble and helpful. Staff doctors were amazing. All like the doctors I got in contact with just helped me in a way, and I don't think I can ask for more, honestly.
So you think that whatever you have learnt with us here will be helpful in your Ayurveda practice when you go back home?
Oh, absolutely, absolutely, tremendously.
How was the ambience and the facilities that were there in your room where you were staying?
Oh, where am I staying? Oh, I had a great room, perfect air conditioning, fan, everything that I needed actually. So filtered water, like whatever is osmosis water, so everything, no complaints whatsoever.
If you are given a chance, would you like to visit us again?
So actually, I'm planning. Actually, I already made arrangements, so I can come back in September for more days because my visit was kind of short. So I'd like to make it a little longer, so I can learn more.
Thank you so much. On the behalf of the hospital management, Professor M.B. Puranik, who is the president of the whole institution, on behalf of Principal Dr. Ravi Ganesh and Clinic Head Dr. Amrita, on behalf of Dr. Hebbar, the Easy Ayurveda whole team, we thank you for recording the testimonial and being our guest, and we hope you to see you soon.
Thank you. It was a pleasure. I hope I'll see you soon.